Hello, everyone. I see our attendees coming up, so I'll go ahead and just get us started. Introducing STEP, talking a little bit about what programs we have going now and what's to come as folks continue to join us here. I also see some faces that I'm recognizing from our in-person event yesterday. So fun to get to meet you and hoping to meet more of you in our coming weeks. I'm starting by sharing my screen here. Let's talk a little bit about the STEP program. So if it's your first time joining us, we are in a webinar, and what that means for you as our participants is that we cannot see or hear you. You don't have the option to come off of mute. We aren't able to address questions by raise of hand, but things that you'll see in the bottom there are a Q&A box. As you submit questions, we have folks here in the crowd who will go ahead and answer those. We'll also do a Q&A at the very end of all of our presentation. We will cover a lot of different topics across the health spectrum at UCSD today. I do want to address that we are going to talk more about mental health, but we've separated that out into its own day happening later in this series. So today's going to be focused on not all of our health. We know mental health is a piece of that, but that has its own day later in our series. So as we talk about STEP and what is to come, I want to make sure that everyone who's here is registered. This makes sure that you're getting all of our recordings and all of our notes within 24 hours after each of these sessions finishes. Simon is taking furious notes behind the scenes, and that way you have everything you need with all the links included, so you are ready to go. This is an example of one of our transfer talks. So if you are just joining us for the first time, you are seeing it live in action. What this means is we have the experts on campus come and present on all topics throughout the summer. And these are things that are just making sure that you're ready to enroll in classes and you have all the info you need to start this fall. Other topics we'll continue to talk about this summer are parking and transportation, how to pay your bills, getting involved in research and internships, and more. Today's topic is going to be your health at UCSD. So hopefully we will get all of your questions addressed as we have so many of our experts here in the room. So something that started just this week, which has been really fun to see, is our Transfers Connect. So if you're hoping to break past our webinar features and get a chance to interact with each other, get to meet some of our staff and student staff, we are having transfer socials. We call these Transfer Connect. So we'll have these in person. The next one will be August 8th. That would be something that you would register on the link that Simon just sent. We have one tomorrow for our first gen transfers. So looking forward to meeting some of you then. And our research and involvement series is coming up very soon. We have Elizabeth here with us. She is our research and involvement coordinator here at the Transfer Hub just for our transfer students. And it's going to be teaching you about how to build resumes, do internships, and get connected around UCSD in collaboration with our career services and some other study abroad and other important offices around campus. Looking ahead to what's coming up immediately within the STEP program, we are having a very busy week. So we saw some of you in person for Connects yesterday. Thanks for joining us today for this presentation. If you are a first generation college student, we're having a first gen transfer social, which will be virtual tomorrow. We'll have a presentation on some of the services that are provided for our first gen transfers and give you a chance to mingle amongst each other, have some breakout rooms led by our wonderful peer coaches. We're excited to be able to see you all there. Next week, we're going to actually have kind of a non-typical week. We have a transfer talk of I'm an international transfer student, but rather than having that as a synchronous day like today, we'll send you the recording and the notes because we were unable to run that at the normal time. We will send up contacts as well, so you will have a way to ask your questions. During next week, we are going to be launching our midpoint survey. So this is our second year of running STEP, and we want to make sure that it's meeting the needs that you have and answering the questions that you want. So that will go out next week. We have some really fun prizes. So everyone who completes the full survey will be entered in a raffle to win either a pair of AirPods. We have 3 UCSD sweatshirts and we have 3 hydro flasks. So you'll be getting more info about that tomorrow when the survey goes live, and we hope that you can give us some feedback and let us know how you've been liking the program or what you might want changed for next year. And then We will come back together on July 29th and host a virtual social for our transfers with dependents. This is what UCSD calls our parent association, or if you have legal guardianship of any children, we're going to have a social and a little info session for a chance for you to get to meet some other folks who have that shared identity and who also are caring for dependents on campus. So that's all about our STEP program. For those of you who are just joining us, or for those of you who have been with us, thanks for coming back. I'm going to go ahead and stop sharing here. We have some wonderful presenters from all different areas of health. Jill, I'm going to have you share your screen as I do infos here, but the folks we have joining us, I did just get it, but Jill, you're sharing. Do you want to stay through? The email just came. Okay. I'll have you share. So our presenters today are going to be Jill, who is our insurance billing and medicals records manager at Student Health. We'll have Annie, who is our director of nursing at Student Health Services, Dr. San Miguel, who is our director of medical services for UCSD, and May is going to be behind the scenes with Simon, myself, and Elizabeth answering your questions in Q&A. So I will pass it to Jill to take it away.
Thank you, Tessa. We're happy to be here today to give the information to the transfer students on our student health insurance requirements and what our student health clinic has to offer you here on our campus. Again, my name is Jill. My pronouns are she, her, and hers, and I am the insurance manager here at Student Health. And I'm going to tell you about the SHIP program and what's required as a registered student of UC. This is a picture of our Student Health Center, which is centrally located on campus, right across from our Price Center eateries or the Target convenience store. Stop by anytime. We're right down from the Geisel Library. These are some helpful QR codes that we put together so that you can expedite this presentation. We have the UC SHIP QR codes, the Student Health Clinic QR code, the waiver code, and the RAFT, which we'll talk a little further about at the end of this presentation. So why SHIP? Well, SHIP stands for Student Health Insurance Plan, and it was built for students with students actively involved in its design. UC SHIP provides high quality, affordable, and convenient coverage that protects students from unexpected healthcare costs. All UC San Diego students have access to student health and our counseling and psychological services known as CAPS. If you're referred to an outside provider, you will use our SHIP coverage or the insurance you waived with to access specialty care benefits. Students seen at our student health clinic are categorized with one of the three payers designated. That would be our SHIP, which is the student health insurance plan that's underwritten by Anthem Blue Cross PPO. We are your primary care physician home here at Student Health. If you selected a RAFT as part of the waiver process, or you're seen on a fee-for-service basis, and our insurance coordinators here can provide you with an itemized bill that you can try and seek reimbursement from your home insurance with. Dr. San Miguel, who is our medical director here at Student Health, is going to provide you with some insight on the services available at Student Health on campus.
Thanks, Jill. Welcome, everyone. Congratulations on coming to UCSD. So our clinic actually provides a full spectrum of care, and students who come to our student health clinic, which is again located very centrally across from the Price Center, across from Target, and people can come in there and see our physicians, our nurse practitioners, our nurses, either in our urgent care facilities or our primary care sites. We also have our own lab, pharmacy, X-ray. We have our optometrists, we have dietitians, social workers, and a behavioral health team. So it's truly one-stop shop. In addition to having, if you have, we have our insurance folks on staff as well. So we really welcome the students to come. All students are welcome to come to Student Health, as Jill said. Any services provided if you have UC Ship are fully covered. The reduced access fee also is something that I would encourage you to consider if you've waived out, especially if you're going to live on campus, because any services we provide on campus are in-house at Student Health are covered. So our Student Health Clinic is open Mondays through Fridays. Most of our hours are from 8 a.m. to 4 p.m. But on Mondays during the active year, active academic quarters, we're open from 8 a.m. to 6 p.m. And on Thursdays, we open at 9 a.m. This coming year, we're looking at having some additional extended hours through telehealth appointments on Thursdays and on Saturdays. So one way you can either go through My Student Chart. Hopefully all of you have activated My Student Chart to get your incoming requirements in, but that's one way you can either schedule an appointment for primary care or for optometry lab, nurse's clinic, or you can send messages to your provider. It's a wonderful way of working directly with our team, and our urgent care service is available, and you can walk in and get care for any urgent issues. Thanks, Jill.
Thank you, Dr. San Miguel, and she's going to come back, so but she has more to tell you. I wanted to talk real quickly about the SHIP benefits, the Student Health Insurance Plan benefits, so you understand what your fees are that you're hit with on your registration. One of the non-academic requirements of being a student at any of the UCs in California is that you have to have comprehensive health insurance. We want to make sure that you have a doctor nearby that can take care of you if you get sick or if you go for preventative care or you need a diagnostic service. So we automatically enroll all students in the SHIP program. If you would like to opt out of that, then you would need to file a health fee waiver. And we'll be talking about the timeframes for the waiver after I tell you about the benefits of the SHIP program. So the SHIP program, again, is underwritten by Anthem Blue Cross PPO. The Student Health Clinic is your primary care physician clinic, so you want to start your care here. We bill everything to the Anthem Blue Cross plan. The only things that you would pay for at our Student Health Clinic would be a copay for prescriptions, or if it's a service that's not covered by the insurance plan, but most are. You can schedule appointments through My Student Chart, and we have very reasonable access timeframes to see providers because we only see students. We don't see staff or the public. So to get started with the SHIP program, if you are staying enrolled in the Student Health Insurance Plan, to get your insurance card, you would download it as an app on your phone or your mobile device by downloading the app Sydney. And that's Sydney Health. It'll have a little picture of a ghost, and here are some instructions for you to download that. This can provide your insurance card front and back. It also can track your claims that are being processed. And it also provides you with providers that are contracted with Anthem Blue Cross that you might want to go see in the community if you are referred for specialty care. Under the Student Health Insurance Plan, it is a PPO benefit, which means it's a participating provider organization. And it allows you some versatility in your choices. Although we are your primary care physician office and you always start with us, we require that a prior referral is received before you go to a specialist of any sort or to get a diagnostic service or get a hospital-based service. So under this tier of benefit with the health insurance, you receive 3 tiers of coverage. It's up to you to choose once you receive a referral from one of our providers. If you want to go see a UC provider, and we have hospitals throughout the state of California that your SHIP works at, all the same, and you can also use any of the student health clinics throughout the state of California and receive the same benefits. If you go see a UC provider, let's say you come to student health and they refer you for allergy. If you want to go see an allergist at UCSD here in San Diego, we have 3 beautiful acute hospitals where we house over 300 specialists. You can schedule an appointment right through My Student Chart. They'll see your referral through the medical records keeping system, and the copay to see a specialist at UC is $10. If you go and have a hospital-based service like an MRI or a CT scan, or you have to stay in the hospital, those services are covered at 90% under this plan, and you pay 10% coinsurance. Under the second tier of benefits, if you wanted to go see an allergist that's not associated with the UC providers, you would contact Anthem, give them your zip code, and they'll give you a list of providers that are contracted with them that you can call directly to schedule an appointment with. Your copay to see a specialist under the Anthem Blue Cross network would be a $30 copay. If you have a hospital-based service or a diagnostic service, there's a deductible that comes into play immediately. And the deductible is what you pay the first set of bills up to $500, and then the insurance will kick in and pay at 80%. You still have a 20% coinsurance obligation. If you decide that you get a referral for an allergist and you want to see someone that's out of network, that means that they don't hold a contract with UC. They aren't under the Anthem network of providers. They generally are a private practice doctor that expects you to pay up front. You can seek reimbursement on the back end, and that would be covered at 60%, but you do have to pay the first $1,000 of the bills, whether it's the evaluation or diagnostic services. So it gives you great versatility, but to save you money, if you are referred to a specialist or a hospital-based service, it's always best to check with UC because you're going to save some money going to see them. I'm going to turn it back over to Dr. Sam Miguel, who's going to tell you about our mental health options.
Great. So just as just kind of for to let you know, Student Health Services is part of our Student Health and Wellbeing Cluster. And we're part of Student Health, Counseling and Psychological Services, which is CAPS, Health Promotion Services, and then our admin department. And so there are mental health options that are covered by UC SHIP, but also just FYI, CAPS will see students regardless of your insurance, and CAPS does not charge for any mental health care that is provided by their CAPS providers. So if you have UC SHIP, though, your options are even more expanded. You can either contact CAPS or Student Health at the phone numbers listed to request an appointment or to request a referral for an external provider. You can also reach out potentially through My Student Chart. The UCSD College Mental Health Program is through the UC San Diego Health Department of Psychiatry. And so you would have to get a referral from CAPS or for Student Health to see a psychiatrist or psychologist at the UCSD College Mental Health. It's separate from CAPS and Student Health. It requires a $5 copay per visit. And again, you need to get a referral from Student Health or from CAPS, and the referrals are good for 1 year or up to 52 visits. Referrals for Anthem Blue Cross providers outside of UC San Diego Health that are in network are a $10 copay per visit, and referrals are valid for 1 year or up to 52 visits and may be used by other providers. There are other mental health options for students with UC SHIP, and this includes Life Health Online. And students can access our website or access the Life Health Online website and provide your UC SHIP information to get connected with one of their mental health providers. The other thing is just, this is also very important. So Student Health Services, we have our own urgent care that you can come in to be seen for urgent issues, like if you got injured and you have a sprain or a strain fracture, or you are not feeling well, we can see you. But when we're closed, we do have an advice nurse line that is available for all students, regardless of their insurance. You can call our main line and talk to a registered nurse, and they can tell you if you need to go to the emergency room, or they'll give you advice for self-care, or if it's appropriate to call your doctor's office the next day to schedule an appointment. If you have an urgent situation that is not really an emergency, you can visit the UC San Diego Health System Urgent Care. It's right across from campus on Via La Jolla Drive and La Jolla Village Drive. The copay for that is $25. But if you are having a true emergency, we actually have UC San Diego Health are at the Thornton Hospital. We have an emergency room. The copay is higher. It was $125. I think it's moving up to $150 this coming year. And if you're admitted, then UC SHIP will cover 90% of the charges for a UC facility. But we work very closely with our UC San Diego health providers to make sure that you're cared for and that we try to keep costs down as much as we can.
Thank you, Dr. San Miguel. And just a reminder, referrals are required prior to going to see a specialist or having any care rendered outside of the student health clinic here on campus. The only exceptions would be if you are going to an emergency room, an urgent care, utilizing the dental or vision supplemental care. So for ER, urgent care, dental, and vision, you don't need a referral before you go. So the UC SHIP plan gives enrollees a supplemental curative dental plan provided by Delta Dental PPO. Delta Dental PPO will provide UC SHIP members with $1,000 US worth of coverage for teeth evaluation and cleaning, fillings, x-rays, root canals, and tooth extraction if you utilize a Delta Dental PPO provider. To find dentists in the area, you would contact Delta Dental at their 800 number or go online to their website. You plug in your zip code again, and they'll give you a list of the participating dentists. You can always look on Google or any of the surveying platforms to find out information about the particular dentist and who you may want to go see, what they subspecialize in, what kind of services they have. But you can use Delta Dental PPO at their website to find dentists in the area. We don't have anybody on campus because we don't have a dental school here. So you do have to go out into the community. It's usually a bus ride or a shuttle ride away from the campus. The other supplemental plan that UC SHIP provides is a routine eye exam per each benefit year, which runs from August 1st to July 31st. That's the benefit year for optometry. We supply this benefit through iMed, which is under Anthem Blue Cross Vision. They allow you to have one routine eye exam per benefit year. You pay a $10 copay. And then if you do need glasses and frames, or you want to pick contact lenses, they will give you one time per benefit year, $120 to offset the cost of those services or supplies. So keep that in mind. We do have a full optometry unit where we have beautiful options for eyewear, frames and lenses and contact lenses right here in our student health clinic. We have 3 optometrists that can do routine eye exams, and we also do dilation and medical evaluation for eyes. If you want to schedule an appointment, you can do that through my student chart, or you can contact them at the phone number provided. If you want to find a provider outside of student health, you can do that as well. You don't need a referral for this service. So you would just call the 800 number provided there to speak with someone at iMed. And they, again, will take your zip code and provide you with a listing of providers out in the community you would want to go see. So for those students that have insurance already through a private plan, a government plan, or through your parents, you can waive the health insurance requirement by providing a waiver application through your Triton link. You have to do this during the open timeframes. We do not accept retroactive waivers or late waivers, and you have to act upon registration. So when you register for classes, you would just want to jump over your Triton link and log into your single sign-on. It will take you directly to an application where you need to provide insurance information, generally right from your insurance card. They'll need your subscriber identification number, who the subscriber is, what kind of insurance it is, and they will ask you to upload a copy of the front and back of your insurance card. At the end of that application, there's a final question that says, would you like to grab a raft? And it gives you information on our website about what raft is. And basically it's a bridge plan. It's not insurance, but it's a membership to come into the student health clinic and receive scheduled appointments, lab services, and x-rays at no additional charge. And I'll talk more about that in just a minute. But to avoid paying the health fee, which is pretty hefty, for undergraduates this year, it's $898 per quarter, and graduates pay $1,881 per quarter. If you need to file that waiver, please act timely. The time frame is right now. We're open all summer until September 14th. We will reopen the waiver from September 15th to the 20th with a $50 late fee. So when you register for classes, jump right over to that Triton link, click on the hyperlink for the health fee waiver, and it'll take you to that application. It's super important that you pay attention to your UCSD email because that is our #1 means of correspondence here on campus. And we send very important messages through there that you may need to act on. So when you file a waiver on the Triton link, you will immediately get a tentative approval email that will go to your UCSD email, and it'll tell you we have received your application and we need to verify your coverage and eligibility. It takes about 7 business days for them to deliver a final decision. And again, that decision will be delivered to your UCSD email. If it's approved, denied, or it's pending for more information. So super important to be checking your email once you file that waiver. So this is a picture of the Triton Link website currently. You'll see under the financial tools, health fee waiver /raft. You're going to click on that. And again, that will take you to the automatic link that will take you to the single sign-on where you'll access that application. Generally, a copy of your summary of benefits from your health plan may be required. It's always good to go onto your website, develop a profile through your health insurance so that you know what your benefits are. So when you go to the doctor, you know how much your copay is or how much it might cost you out of pocket. If the insurance that you provide through the application is not verified, they'll ask you for further information, and that's when you want to provide the summary of benefits. And that's what that is on the screen, the required waiver information. So as I said, the last question on that application for the health fee waiver, would you like to grab a raft? This raft access fee is to come to our student health here on campus. It doesn't work anywhere else. You can schedule as many office appointments with our providers as you'd like during a quarter. It's $70 per quarter. And if you were coming into our clinic and you waived the insurance and you were a fee-for-service patient, you generally would pay anywhere from $89 to $159 to see a provider in evaluation. If you needed a lab service, it may be an additional $15. If you needed an x-ray, it could be an additional $50. So one visit can pay for that $70 membership fee. It's a good peace of mind for parents that are sending their students off to the school, and they may not know how to navigate the streets of San Diego to find their provider. It's always good for the student to know they can come right on campus and have those services and not have a big financial burden after seeing a doctor. So please consider picking up a raft. We again call it the reduced access fee for Tritons. Each campus has a little bit of a different bridge plan, but again, this only works here at San Diego. It is not an insurance, but if you pay that $70, you can see doctors, get lab services and x-rays without having any other financial burden. The raft does not include pharmacy, so it doesn't pay for your prescriptions. It doesn't pay for dental work, optometry, or vaccines. And services that are obtained outside of the student health clinic are not covered by the raft. If you have your own insurance, you're going to use your own insurance. You would see one of our doctors. If you receive a referral from one of our doctors, then we're going to turn you back to your insurance where you would contact them and find a provider that you should go see that can bill your insurance company. So please consider this. It is a great program. I am a parent of a college student, and I certainly would pick up a bridge plan if I could. So there are some important timeframes to keep in mind. Right now, please take a look at your insurance, see if it meets your medical needs. And if you would like to be part of the SHIP, you don't need to act. You will be automatically enrolled, and your first day of coverage would be September 23rd. That's our official first day of fall quarter, and it is renewed on a quarterly basis. If you don't want the SHIP and you need to use your home insurance, please act between May 6th and May 14th so that you're not hit with a $50 late fee. Go on to your Triton link, fill out that waiver application. If you forget and you think about it on the 15th of September, it's still open. You're just going to pay a $50 late fee. And then again, September 23rd is the first official day of the fall quarter. You generally start classes about that Wednesday or Thursday of the week. But this is when the insurance will kick in. I want to leave you with some resources. There's a lot of information here, and I'm glad this is recorded so you can go back to it, or you can refer a friend or a parent or a family member. These are some websites and phone numbers for the insurance options. Also contains our student health clinic, our CAPS. If you have questions and you need help with the insurance, my team is on there with the phone number. We also meet on Zoom Monday, Wednesday, and Friday from 11 a.m. to 12 p.m. And we'll be glad to help you. Thank you. And if you do have any questions, you forget and you find out, you remember after this session, send us an email at ship3@ucsd.edu and we'll be glad to answer you. If you give us a call, we'll be glad to talk to you about it. Or go on our website and take a look at what we have to offer. Also connect with us. We are on Facebook, Instagram, and YouTube. And there is lots of information on our website that will help you make a good informed decision. Otherwise, give us a call or email us. Thank you for your time today. I'm going to introduce Annie Horton, who is our Director of Nursing here at Student Health, and she's going to provide you with some insight on the incoming health requirements this year.
Thanks so much, Jill, and welcome everybody. Thank you so much for joining. This piece of the presentation is really about supporting you to get compliant with any of our incoming health requirements and give you the opportunity to ask any questions. So we have health requirements in all our UC schools to help reduce the likelihood of vaccine preventable outbreaks of illnesses. We know that outbreaks, as we have seen in very recent times, causes huge academic and personal disruptions. So anything that we can do to support the community to stay as well as possible, we are going to do. And that's what our TB and our vaccine requirements are aimed at doing. What the health requirements that we have, many of you will have started this because we've been receiving hundreds and hundreds of submissions from you all. The first one to focus on is tuberculosis screening, and if the system suggests that you need to do testing, then the system will determine risk from that questionnaire. And then we have a series of vaccinations that we require, as well as now the COVID-19 and influenza will be required during the fall and winter of 2024-2025. If you remember nothing else from this presentation, just know that on the Student Health Services website, we have a page dedicated to incoming health requirements. So you can go on there and have many of your questions answered. It has all of the forms that you may need, the TB testing form if you are required to test. If you wish to use our immunization form, it is on there. There is information regarding exemptions and waiving out of the COVID-19 vaccine if that is what you choose. So please go on there and check that out for any additional information. Signing up for my student chart, as Dr. Sam McGill mentioned, is really the first step in this process, and hopefully many of you have done that, because that way, obviously, you're able to make a start on these, but also we can communicate with you and I can send you out reminders as we come up to deadlines and as we come up to hold dates. And so if you are having any issue with logging on, what you will be using is your AD login that you use for the university. So that is your UCSD email and password that you are given soon after accepting a position here at the university. If you are having any issues, there is a link there on Blink that you can get support around that process for. On our website, there is a link to my student chart, and you can have this up on your desktop. You can have this as an app on your phone or your iPad. It is probably better to do this process on a desktop or laptop. And I just want to highlight that this is the landing page to sign in, and please don't use the lower part to sign in, which is what UCSD patients utilize. But we have a special way that students go in just using your AD login as mentioned, and that way you have access to be able to message us without having ever been a patient here yet. And you, even outside of the country, you can message us. So that is a big advantage. And if you go in the incorrect way, you won't see all of the incoming requirement pages, etc. So if you go in and it looks a bit strange, back on out and go in using your student AD login. Logging in, you will be able to get to all of the stuff that you need for these requirements. COVID-19 sits in a slightly different place, but if you go to the menu in my student chart, you will be able to access immunizations and screening, which is where you do your TB and regular immunizations, and then menu and COVID-19 for COVID-19 vaccines. The advantage if you actually start with the COVID-19 submission is that you can hit a button and pull in vaccines from Epic that you are connected to if you have opted in to Care Everywhere. So it will bring everything in also from the registry in California. If you receive COVID vaccines or other vaccines in California, it will automatically put them in for you. So it will save you a little bit of work. You're also able to upload your immunization forms or records and your TB testing form if that's what's required. There's little buttons there that you can attach those to. Immunization requirements. So we have just passed the deadline, but that is okay. So the TB requirement holds go on at the end of this month on the 30th. So there's still a little bit of time. This requirement is two parts for many people. For some people, it'll just be one part. So the first part that everyone starts with is answering some risk screening questionnaires. And then if you're prompted, you will download our form off our website and take that to your healthcare provider, wherever you are. And you can provide testing, either PPD or a TB skin test, or a MAN2 test, depending on what it's called in your part of the world or the country. An IGRA blood test, which is often called quantiferon or T-spot, or a chest x-ray, which needs to be in English. And all of your testing will come to the student health nursing team to review, and we will be sending messages acknowledging that testing. And we will reach out to you if anything is missing or any items you need to do to follow up. And please get onto this requirement as soon as possible, because those enrollment holds do stop you from being able to sign up for full classes. So we really want to avoid that. But if you do get one placed because you haven't been able to submit on time, do not panic. As soon as we receive that testing, we will process it and those holds will be automatically lifted. So just submit as soon as you can if you do pass that hold date of July 30th. As far as the immunizations requirements go, we do allow more time for these. We do want you to get started and put in as many vaccines as you have had. However, we don't place holds until November 1st, giving you the first part of the full quarter to get anything that you are missing. For many of you, you will come to student health to get those, so it's super convenient. You can come in. We have big vaccine clinics here, fast turnaround clinics that offer flu, COVID, Tdap and HPV, and then our nurses clinic that offers all of the other vaccines. And so you can use our form to guide you with your immunizations, which is on our website. And it can be very helpful if you are needing to go to your healthcare provider, because it will outline to them exactly what is needed. Or alternatively, you can use your own vaccine records if they're clear, legible, and that you've received everything. Our form has a second page to it that contains strongly recommended vaccines that are really great to have in your medical record with us. Very helpful if you are going to be doing any of their travel abroad programs. And so enter as many vaccines as you can, and they are housed within EPIC, which is our electronic medical record, and their information is safe and secure there. And yes, please do submit, even if you know that you haven't had everything. We are busy processing the TB submissions presently, and then we are moving on to the immunizations. So yeah, just move on this as quickly as you can. As far as individual required vaccines, just a little bit more detail. The Tdap vaccine is a dose on or after the 11th birthday, and they do need to be given every 10 years, so we may prompt you if you are due for another one. We have varicella, which is chickenpox, and it is 2 doses of that vaccine, with the first one being on or after your first birthday. If you received it way before your first birthday, we will be asking you to get another dose or to provide a blood test called a titer. If you had chickenpox as a child, then a blood titer would be the most appropriate way of showing that you have immunity. And online and in our form, we have spaces for those blood test results. MMR, same rules as varicella. You can either have 2 doses or a blood test. If you come from a part of the world that gave these vaccines as individual and not a combined MMR, then you need 2 doses of measles and mumps and at least 1 dose of rubella. The 4th vaccine requirement is the meningococcal ACWY vaccine. This is for students 22 years and younger, and 1 dose has to be on or after the 16th birthday. Many people had doses, but prior to that 16th birthday. Brand names in the US include Menactra, Menveo, Med-Quadfi. So you might see that on your vaccine record, and not certain, but it is this required vaccine. The vaccine that it isn't is the meningococcal B vaccine. There is space to enter this if you have had this vaccine, but that's not the required version. It is the ACWY vaccine. COVID-19 vaccine. As I said, there's a special place where you enter those, and the current updated dose is the dose that is required. Now, the one that came out in September of 2023 has just stopped being distributed. And so there is a new one that is coming out in the fall of 2024. The only vaccines that I know that have been updated to current versions of the circulating variants is Pfizer, Moderna, and Novavax. And as I said, they will have new updated versions due out in the fall. We do carry these vaccines, well, Pfizer and Moderna, but many retail pharmacies carry Novavax if you choose to wish to get that one. You can decline this vaccine for strongly held beliefs, and you will find that on our immunisation form. And there is a separate form that you can download off our website for declination. There is also medical exemptions available if you've had a past reaction to this or any vaccine, actually. Frequently asked questions if you're having trouble finding your vaccine records, other schools you've been to, childhood records, high school, colleges, health, your PCP. There's all sorts of places that you may need to pull all those records in from. If you cannot absolutely find them, we've had people that the PCP offices shut down and they never had copies, and so you can, as I mentioned, get blood tests for measles, mumps, rubella, and varicella, but not for Tdap and meningococcal. So if you need to have those, you would need to get updated doses of those. If some of these vaccines are not available to you because of where you're coming from or barriers such as cost, you can wait to get the vaccines when you come to student health. If you are taking up UC SHIP, there is no fee for that. So that is a real plus. And as I said, we have lots of clinics running all through the full quarter to help you get anything that you might be missing. If you had BCG vaccination as a child, do you still need TB testing if it's indicated? And yes, you do, because it does not offer or provide lifelong protection from tuberculosis. If your skin test or your blood test for TB was positive, you will need to progress on and have your provider order you a chest x-ray. If we see that you've had a positive test without a chest x-ray, we will prompt you to make sure that you get that. If your records are not in English, we do ask that you have them translated. If you have religious beliefs that exclude vaccines, you can decline at this point in time just the COVID-19 vaccine, but not the other vaccines. If you have an allergy or any other medical reason why you can't get any of these vaccines or some of these vaccines, then there is a medical exemption form on our website, that you will take to your healthcare provider to fill in. And that needs to be an MD, a DO, an NP. Hopefully I haven't missed any, or a PA, that's the one I've missed. And just a shout out for the deadlines and enrollment holds. So we've passed our deadlines. So now we are really encouraging you to get going with these requirements to avoid holds, the first being tuberculosis on July 30th, and the next one being the immunisation hold on November 1st. Now, the immunisation hold will prevent enrolment in winter classes, whereas the July 30 will prevent enrolment in fall classes. And if you need help, there is a wonderful menu item within my student chart called Ask a Nurse, and you can reach out to us. And many of you have been. We receive lots of messages. We prioritize answering those questions through office hours as well as out of hours. There are nurses that will help respond to your queries even on the weekends. If you are having technical issues, there is a email address there that goes to our medical records, and we have a team of people that can assist you with that. Everything is on our website, and just really the take-home message is to really activate your My Student chart as soon as possible and complete those requirements as soon as you can, so you avoid holds. If you do end up with a hold, do not panic. Just get everything in as soon as you possibly can, and then those holds will be lifted on a daily basis. And this is some of our nursing team, and we are definitely here to support you in this process. So please reach out if you need any help with this. Thank you so much.
Thank you so much to all of our presenters. I always learn more as I continue to go to these presentations, so thank you so much. For folks who still have questions, please feel free to use the Q&A box. We did have a couple FAQs that I captured as we were going through. One of the ones that I saw was, if I have my own personal healthcare and I don't go through SHIP, can I still access UCSD's health center on campus? And what would that process look like?
Absolutely. All students are welcome to come to Student Health Services. And you can always we will verify what insurance the student has, at the time that they check in. And if they've waived out, again, we would recommend getting the reduced access fee for Trans-Raft. It's a great deal for $70 a quarter. Even if you go once, it covers your visit, your labs, x-rays, most of the testing. And even if you are needing to get titers or quantiferon testing, or if you want to self-order STI testing, it's such a great deal. I don't know if students understand what a great deal it is. And if you go twice, even you're getting even more of your money's worth. So yes, you're always welcome to come. If you don't have Raft, we will charge you for services, and you can pay with credit card. We do have the ability to bill your student account, but we prefer if you just pay at the time that the services are rendered. And FYI, our costs for over-the-counter medications at our student health pharmacy are much lower than Target, Walmart, any other retail pharmacy. So you can just come in, even if you don't have SHIP, and get like cough medicine or Tylenol or Advil or anything like that. So please use our services.
Thank you so much. Let me see. So, Annie, you spent a while talking about, but I want to make sure that we are clear here. So I need to make sure that my TB tests are in by technically last week, but as long as I'm getting them in by the 30th of this month, I'm not going to see any holds on my accounts. Is that correct?
That is accurate. If you submit the day before the holds go on, we may not have had an opportunity to process you. So it may go on briefly and then come off as soon as we've been able to process. But no, generally speaking, if you get it in between now and the 30th, we will be able to process those.
Okay. That sounds great. And then for immunizations, they're able to, that would affect their holds for the winter quarter. So they just need to make sure that they're adding those to their health plan as they are getting those, and they'll need to do that. Otherwise, there'll still be a hold later.
Yes, correct. Yes. We provide a little extra time because we understand that people aren't able to get everything in some countries and in some parts of the US.
Perfect. Those are the ones that I saw as our big frequently asked questions. I did see that we had one person ask a question that you were going to address live about the number of COVID vaccines.
No, it was actually regarding not seeing something as completed on the applicant portal. And I
Okay.
just wanted to say that the applicant portal and Student Health Services electronic medical record do not communicate. So because we don't share information outside of our electronic medical record. Whether that says complete or not, it's not likely to reflect reality. So please, everything in regards to this process, you should confirm or look for messaging from the nursing team within My Student Chart, not the applicant portal.
Perfect. I don't see any more questions. Oh, we do. Let's see. I don't see too many more questions popping in the chat. I think maybe Dr. San Miguel, would you mind just addressing out aloud the question of how you access services on campus with Raft versus without Raft, and maybe providing that clarification?
Oh,
Maybe that's better a Jill question. I'm not sure.
So Raft is only for student health services. So if you have your outside insurance, say, and you waived out of UC SHIP, then those students who've waived out, but they'd like to come to student health services and not pay our certain fees for each service that is provided, then they should purchase Raft. And you can actually come in as many times as you want that quarter. It's not limited in terms of if you buy Raft, it's good for that quarter. And you can come in and get the services that you need. And it's not limited. So it's not one per quarter or twice per quarter, but whatever services you need. And so some students will come in and be seen in urgent care, and then they decide that they want to order their own STI testing, so they can go through My Student Chart and order STI testing like HIV, syphilis, chlamydia and gonorrhea, and then without seeing a doctor, and then they just go into the lab, have the test done. So it's a really great deal, actually.
So they pay $70
Yeah.
and that gets their entire quarter worth of access to healthcare on campus only.
Yes,
If they
but
had a greater emergency, it would not cover them elsewhere.
yeah, but what Jill also mentioned is that since our pharmacy doesn't take outside insurances, if a student with Raft comes in, if they want the insurance to cover the cost of the medication, then we will send it to an outside pharmacy like CVS or Longs or Walgreens. And also, if we're seeing someone that needs a referral, let's say it's a condition that we can't completely handle at student health, then the student would have to go to their primary care provider. And we can always make suggestions about specialists we know over at the UCSD system, but they would need to go to their own private primary care doctor who carries their insurance to get the referral from their primary care provider.
Thank you so much for that clarification. And I see, I'm seeing in the chat that that can also be $210 for the year and then used during breaks as well. So it's not just restricted to the weeks that we have classes going.
Yes.
That's right. We do also do telehealth visits. So if a student is away from campus, they can call us to get a referral, or they can have an appointment if they're in the state of California.
Fantastic. And I'm seeing Annie's dropping all of these great links in the chat in regards to where to upload your testing forms or see resources on them. And our questions in the chat have been answered. So y'all have been giving us such great info. Dr. San Miguel, did you have something else you wanted to share?
Yeah, I would just put in a plea. I know that people get anxious about when there's a deadline and they want to get messaging, and maybe I can speak for Annie. Like, if you have a question related to your specific situation, the best way to is to connect with through My Student Chart, through the Ask a Nurse team, because then the entire team can see if anyone has responded to that message and the answer has been given. Students and parents sometimes panic and they start calling or emailing, and it's hard to track and know what's been answered, and it just kind of clogs up the system. So at least for the TB requirements and the immunization requirements, we really strongly encourage you to go through My Student Chart, Ask a Nurse, to send in your questions. Our nursing team is working almost 12, 16 hours a day and on weekends to answer these questions, and they're going through hundreds of questions. So that would be the most efficient way. Otherwise, we don't know if you had been given, we want to make sure you get the right instructions. And Jill, for waiver questions, what's the best way?
The best way is through ship3@ucsd.edu. We have someone that responds to those on a daily basis. During our heavy times during August and September, there is someone manning it, usually on weekends or during the evenings. So you're going to get a response usually within 24 hours.
Wonderful.
And May dropped it in the chat also. Again, that's our email address. And you'll be speaking with someone like May or myself to answer your questions about the insurance.
Wonderful. And Simon's capturing all of these links as well. We will have these in our notes that go out tomorrow. So we will have all of this ready for you, including that ask a question feature, because that seems very useful. I think that's it for oh, actually, I did see a couple questions that I was going to ask. So sorry. In regards to number of COVID vaccines, is there a requirement, or is that something that might change in fall? Not that we can predict the future, but what is the current requirement for that?
It's not a number of, it's an updated dose, very similar to the influenza vaccine, in that every fall it will reflect the current circulating virus. And so the requirement is an updated dose. So it will be in the fall and winter of 24-25.
Okay, that is helpful.
Yeah, and there was a question about getting your vision checked. Oh, looks like May's answering that. I think you actually have to have SHIP unless you're an early start. Then you'll have to wait till September 24th, 23rd, September 23rd, in order to use your vision to get seen. But we have a wonderful optometry department.
Well, thank you so much. We will pass on all of the contact information for you to be able to keep getting these questions answered. Oh my goodness, my tongue-tied today. We will continue to answer your questions over our emails that are shared in that Ask a Nurse feature. For those of you who are first gen and are joining us tomorrow, we look forward to seeing you in that Zoom from the Triton side. And thank you so much to all of our wonderful UC Health providers. This has been so helpful, and you're getting a shout out for all of your informative information in the chat as well. So thank you so much. Bye, everybody.
Thank you.
Thank you.